Some people get to use the word trauma as just a word that they can put in high sounding words. Some people sort of understand what trauma actually means. But then again, we are dealing with a whole bunch of humans who have not clocked in on what trauma would be. And today we're going to be unraveling it. We're going to be understanding the word trauma. We're going to be understanding it from a very, very beginner's point of view. And then we'll come to understand why, if an adult should tell you that you're traumatized by a certain situation, we'll clock in on that definition and we'll clock in on what that means. Today, I'm being joined by a renowned guest, someone who has paid her dues, someone who is doing amazingly well in her profession. And today is not just any day for you to watch and not share. Today is that day where you finish seeing this episode and you share, because we're going to be unpacking lots of things. Today, we're going to be discussing on childhood traumas and how it can affect adults and how it actually affects adults. So that person that you're seeing, maybe who is usually giving you a certain sort of emotional behavior, or who is not quite comfortable with you being around, that person who you get to see who is always anxious, that person who you see who is always detached from emotions, just, putting their two and two in front of you and telling you that they don't trust you, you sort of understand that just maybe that act would be coming from a place of childhood trauma. We're being joined today by Dr. Julia Ogunga. It's such a pleasure to have you here, Ma.
Thank you.
Amazing. Please just tell us more about yourself. Tell us what you've done, what you've been doing, and of course, in your field and profession, tell us some of the things that you look forward to doing in your profession.
Okay. I'm Dr. Julia Ogunga. I'm a psychiatrist, and I consult at Brain Plus Specialist Hospital at Omoguma here. And actually, I have a passion, about psychiatry. And because of that, I have social media handles where I talk about mental health issues. I'm on TikTok as Dr. Julia. I'm on, Facebook. I have a Facebook page, which is Brain Plus Hospital. So you can get me in any of those places. And all I talk about there is psychiatry, really, because I have a passion for it.
Amazing. Well, I can tell you for a fact that you're doing amazingly well. I've followed your TikTok page and I usually learn a whole lot. And that's such a breath of fresh air. Sometimes you go on TikTok and you don't get to learn anything. You just probably laugh and just come out. But trust me when I say you need to follow her on TikTok. Dr. Julia, you're going to learn a whole lot of things that would really matter. Now, when we talk about the world of psychiatry, there are lots of persons who have not yet understood. And I'm just not going to be biased here by highlighting on the fact that Nigerians have not really clocked in on mental health. We are yet to get there. And I don't know if I'm wrong, and I would need for you to help me answer if I am wrong or right. Nigeria, particularly, because I've not left Nigeria. But Nigerians are yet to understand what mental health is. We are yet to even see persons who are willing and ready to even book a session with psychiatrists and discuss about their psychology and their mental health. Do you agree with me on that?
Yes, actually, there has been an improvement from what it used to be before. Most Nigerians believe that mental health issues were due to spirits, and evil possession, and somebody is doing it somewhere. Yeah, but I think today we're really graduating out of that, and some people are more aware now about their mental health issues, and they can differentiate the difference between, religious or, things, spiritual things from, mental health issues. But there's still a lot need to be done, a whole lot.
How do you think we can actually push for more advocacy, mental health advocacy?
Yeah, it's one of them is like what we're doing right now. We're talking about it. And, and then, of course, we, just talking about it, going to schools, talking about it, and then even in the church, because I think some of them, are the ones that are making us believe that they're spiritual things.
Yeah.
So, when you go to a church or a pastor or whatever, I will tell you, okay, it's your mother or your grandmother or mother-in-law that's doing those things.
Yeah.
So we need to educate them. We need to educate the religious people, the religious leaders, so that they will know when and how to differentiate between the spiritual things and mental health issues. Yeah.
Amazing. I really like the work that you're doing, and I really cannot just beat your drum more than I should, but you're doing amazingly well out there. And I just want to say thank you, honestly.
Thank you.
So today we're going to have a conversation that has it has come up in several situations. Lots of people have talked about it. However, the most talked about one will be persons who have been abused sexually growing up, right? And now these victims of sexual assault, of child molestations, they're grappling with the trauma associated with that. That's the one that lots of people key onto. No matter how much we want to emphasize on that, we also need to highlight on the fact that there are people who have had to deal with abandonment from their parents. There are people who have had to deal with young children who have had to deal with emotional abuse. Now, it has summed up to cause them so much trauma, and those traumas we can see in their characters now as adults. There are people you get to see nowadays, and you wonder, from where to where? And you would not know if you're not being told that this person has got some childhood traumas that they need to actually fight. What is childhood trauma?
Okay. Well, childhood traumas, they are chronic events that happen to a child. It's from the environment they're growing up, most of the time from the home, that they're growing up. And, it ends up, because it's these events, these children can't cope with it. So it now ends up affecting them in so many ways.
Psychologically, emotionally, physically.
Yeah, physically, emotionally, even socially. Yeah, even economically it does affect. Yeah.
That's painful. Let's talk about the psychological effect of childhood trauma. Aside from the obvious, which is the fact that it's going to reflect on your adulthood, and not just that you'll be the only person that is being traumatized by it, you also get to, by extension, knowingly or unknowingly, traumatize the people around you as an adult. Exactly. Let's talk about psychological traumas and how it affects children, because I know it doesn't just come up and play out in their adulthood. It also affects them psychologically as children as well. So let's talk about psychological trauma that children get to face, and then let's bring it up to the psychological traumas that adults face as well.
Okay. Children, in the home, they can face it. We call it, emotional abuse or psychological abuse. They can also have emotional neglect. These are the two ways that it can affect them. Emotionally, they traumatize them emotionally. Okay. Yeah, when we talk about emotional abuse, that's so rampant with us. I mean, it's just part of us, especially parents. It comes out of their mouth like water. They call their children idiot, stupid, lodo. They call their children names, bad names that, that go on to hurt them. And then, of course, when some of parents doing that, they believe that, if you do that to them, you make them, they'll become better in life. But that is the opposite. That's the opposite. Then, of course, when we come to emotional neglect, you don't tell the child how much you love him. You don't care about his emotions. You don't read his body language, so that, you don't, you can't read it. You can't tell that. Most of the time, these children feel unloved because of the way the parents treat them. So it's good that parents should once in a while tell their children, I love you, hug them, all these things. But most of our African people don't do it.
Yeah, and that's a problem. And I want us to highlight on that. Most of them, the reasons that they give is that once you start butchering them up with emotions, you see a situation where you say, Mommy, I love you, and she doesn't return it back. Or a situation where you want to give your mother a peck on the chin and she's looking at you like, what's going on? Please don't do that with me. Most of them think that when they butter up a child and provide as much emotions as the child would need, that child end up being spoiled. And in situations where they do not have any form of emotional support in the future, they would not carry themselves. So some of these African parents decide to give what they call tough love. The tough love. They will not tell you I love you. You don't tell them I love you. They don't care about you. The only thing they will tell you, like you see a situation whereby a mother would do something to hurt the child. Say for instance, maybe she's accusing the child of stealing one of her jewelry, only for her to find it. And instead of her to apologize, knowing that she has hurt the child, she would rather say, it's okay, let's leave it. Let's leave it. All of the ones that I used to steal, do I used to say anything? So how do we begin to I know that we're having younger parents who are doing way better when it comes to emotional provision for their children. But let's also highlight on the fact that because we still have some pedigree of African parents who still think being emotionally available for their children is going to butter up this child. So how do we begin to sound it to these parents and tell them that there is nothing wrong with you being emotionally available and telling this child that you care about them and showing up for them emotionally?
Yes, it's very important. By education, yes, we can do that by education through any means that we can get to parents. Especially the women. When you have like August meeting or something like that, if you go and speak to them and educate them on the need, I think they will learn. It's just because it's this thing that's been passing on from our parents to our grandparents, from our grandparents to us, and all that. So you just believe that you shouldn't show up for your child, but it's important. The world is a global village right now, and when you see it happening other places, you'll be wondering why not yours, and then you feel, okay, my parents don't love me if this parent is doing this. So I think it's through education, and I think we'll get there, but it's slow.
We'll get there. I like that. I like that. I like that you said that, and that's important. Let's talk about adults who have been traumatized. Recently, we've had lots of people coming out to talk about how they were sexually molested as children, some certain things that played out. Recently, I had a conversation with a young lady who sort of clocked in on the fact that, how did she even explain that story? She said while she was, I think, 6 years old, when she was 6 years old, there was this man that she knows, and he used to be a pastor in the church. So he comes around. Her elder sister happens to be a friend to the man's daughter. Her elder sister is a friend to the man's daughter. So the man usually come around because they're church members and all of that. And then she said there was one time he touched her in a certain way. And apparently that event happened. But recently, that was when she started clocking in on that event. Like, it happened, but she did not remember that scenario for a long time. But recently, when the man started visiting again, she now clocked in on the fact that such painful events actually occurred. Now, that was the most heartbreaking news I've ever had, because it's one thing for you to know that, oh, this thing happened and you're managing the trauma and you're getting somewhere, than for it to just come on you and just flash back at you the moment you're seeing the person. So there are lots of people who have complained about molestations, and let's focus on molestation and sexual assault, right? Lots of children, lots of adults who are dealing with that. And funny enough, it's now affecting them in their relationships. Most of them are unable to care or love or even want to have anything sexual to do with their partner. These traumas exist, and it's painful that it started off as when they were children, and now it's emanating to them as an adult. And one just wonder, at what point is it going to end? So how would you know? Because some people don't know. How would you know that someone actually has childhood trauma and they need to deal with those childhood traumas?
Okay. The person has to understand that he or she has been traumatized from childhood. Yeah.
Acceptance.
Yes, you have to accept it. Like you said, this sexual abuse is one of the very traumatizing,
Okay.
abuse that a child can go through. Normally, if you have other, you can have other traumas. Maybe if you just once or twice, you get over it. It doesn't mean much. But sexual abuse, just once is enough to get the person, off the rocks. So in adulthood, you might not know, you might not really know that could have been, what caused it. Let me give you an example. I had a patient the other day, and the patient, it doesn't have to do sexual. I'm just using something else. The patient is a male, so he takes substance. And then the patient came in. They told me the whole history and all that. And as a psychiatrist, we like to know, where is it emanating from? Your childhood. We normally go there. So, and I had to ask him, okay, when was it you were taking this? He said, well, he started it in secondary school. So I asked him what really happened around that time. So he now told me the story of what happened in their home. So the whole story, at the end showed that, the parents accused him of something he didn't do. But as a child, he couldn't defend himself. He told them, no, I didn't do it. They didn't believe him, So they, at the end, the mother, according to him, told the rest of his siblings, oh, let's ostracize this guy. He's no more part of us. So he's no more part of us. So they ostracized him. Nobody wanted to associate with him, from the parents to the siblings. So one of the days he of course, with all this, he fell into depression.
Of course.
The parents didn't notice. Most time parents don't know. They don't believe that children can suffer depression. They don't believe that. So the guy fell into depression. So one of the days he went to a kiosk to go and buy something. Then he met one guy there. Guys, they talk to each other. And then they started exchanging, they talked, communicating. And then maybe he expressed to the guy how bad he's feeling inside. The guy just said, okay, come, let me take you somewhere. And that was how he started the substance abuse. So that was it. It was that childhood trauma, that thing that happened in his home. So it's the same thing, in if the person has been sexually abused. Of course, they end up with any of the mental health issues. They can end up with depression. They can end up with anxiety, and the way they projected outside is with the symptoms. And of course, if you don't know what the symptoms of those things, you won't recognize it. But if you know the symptoms, you will know that, yeah, this person has a problem. Or sometimes they might just become aggressive, aggressive, and sometimes they don't want anything to do with a man. Again, they have relationship issues, and even if they do have a friend or boyfriend, or even if they end up getting married, you will still see that freedom is not there. So the best thing, or such people, maybe some of them will go into divorce and all that, but it's not necessary. What the lady needs is treatment, and everything will be fine.
Amazing. While we're speaking, I sort of clocked in on the fact that there's some people who do not want to share what they've been through. The mere thought of recounting that traumatic situation literally would break them in several pieces, and they just don't want to talk about it. They know there is a problem, but they don't want to talk about it. How can we help people like that?
Yes. Some people don't want to talk about it, especially when they are reminded, of the incident. They go through what we call post-traumatic stress disorder. They have flashbacks. They just remember, like the story you just told. This lady now saw the man again, this time as an adult coming to the house. She's having flashbacks. She's remembering what happened at that time, and it's frightening her. Somebody can have post-traumatic stress disorder, and they don't want you to remind them of it. They avoid both conversation, even at the place it happened, they avoid it. So it's only the clinical psychologist actually that can really help them come out of it. Yeah.
So either way, if you don't want to talk about it with somebody else, you should talk about it with a professional.
Exactly.
That's interesting. All right, so I'm going to go back because it's important that we go back. Well, I'm going back because you mentioned something that I want to highlight on. Parents. Most parents think that their job only revolves around providing for their child financially, providing for their child physically, and then neglecting the child to carry on with whatever their emotions are dealing with. You mentioned that children get depressed. And if there is anything that we're going to hold on to when a child becomes something or becomes something they are not supposed to be, is the fact that their foundation failed them. How are we going to? I'm still saying it. I know you said we should reach out to parents, we should talk about it, but there are still some parents who do not have the idea that their children actually require emotional support. So, aside from just talking to them about it, can you please give us tips for these parents who would be watching us right now? Parents who are emotionally closed off on what matters to their children. Parents who think it is a big deal, it's a taboo for you to apologize to your child when you've wronged your child. Parents who think it is okay to say some certain words to your child, not minding how hurt that child would get. I'm going to share a story. This story has been trending on TikTok, and then I think they moved it to Instagram. That was where I saw mine. It was a story of a young girl. First thing first, her parents got divorced. Her parents got divorced, and the father is taking it out on her one way or the other. So she came out on social media to rant, literally. Apparently, her mother called her one day and asked her to come to the house. The father asked her, "Where are you going to?" She said, "I want to go and see my mother. She asked me to come." And then the next thing he said was, "So you're conniving with your mom to see how you can eliminate me." And the girl was like, "What did I do?" And the next thing, he called her a witch. And this lady said, she's 23, going on 24 this year. She said she can count how many times her father has blessed her, has said words like, "God bless you," or "Thank you, it's well with you." She can count how many times he has said that. But she cannot count how many times he has insulted her. So there is an African mentality that people keep purporting around, and it seems to have shaped some children. Some people say, "It's not how my mother trained me and I turned out well." And you keep forgetting that you're dealing with another crop of individuals. They call themselves the Gen Z. And trust me when I say that the manual you used or your parent used on you is not the manual that is going to work this time around. So please help us and drop tips for these parents who think it is okay to use some certain words on their children, who think it is okay to emotionally abuse their children and don't see anything wrong with it. Kindly drop tips for these parents.
All right. Like I've said, emotional abuse is not acceptable, really. But a lot of parents, African parents, do it. So when you emotionally abuse your child, let me tell you what happens. It goes to the brain. And that brain, those words set out, chemical reactions in the brain. But of course, this abuse, the effect it will have will depend on how old the child is or was when this thing started. If they are very young, it's going to be more catastrophic than if they're older. Then, of course, what it happens, there's chemical reactions in the brain. Some will go and affect, the DNA. If you think environmental issues don't affect DNA, they do. They can affect the DNA, either slow it down in the way it's supposed to function, or it will shut it off so that it will not work, it won't function. Then, of course, these those words, those horrible words that we say, can cause what we call cortisol, to be released, by the adrenals. So cortisol is a toxic chemical. If it's short term, yes, that's why we say when it's chronic, if it's elevated chronically, it will go and affect the brain areas. For example, the parietal lobe, the temporal lobe, that's the amygdala, the hippocampus. It goes to these places, and these are the places for our emotions, our memory, and our intelligence, cognitive, in the front. So it goes there. Cortisol will go there and destroy those brain cells. That's what it does. It will go there, destroy the brain cells, and then the brain will now be smaller. If you look at the brain of an abused person, you see it's smaller, especially in these areas, certain areas. The volume is smaller, and then it looks like that place gets filled up with more fluid. So this is what it does. So if you continue to do that, of course, it will now can predispose to mental health issues like depression, anxiety, post-traumatic stress disorder. In short, even schizophrenia, it can predispose the person to it. So what I'm appealing to parents is, learn to love your child. I'm not saying you shouldn't correct them when they do wrong. There's a difference between discipline and abuse. They're two different things. So you learn to be close to. If you're close to your child, if you're close to your child, and of course that bonding attachment starts from even the when the child is in the uterus. That's what science tells us. And then when they come out, you continue to have that bonding attachment with them. They will be able to talk to you. They'll be able to tell you, their secrets, what they have in mind, and you'll be able to put them right. But if you don't do that, they're going outside, and they're going to get those answers from people who don't know any better. And of course, they're coming in back, and then they might go into all sorts of abuse, like substance abuse and all that.
Very important. Thank you so much for highlighting this. I hope parents are listening. I hope you've understood the medical reason why you should not be throwing insulting words on your children, the medical reason why you should not be abusive to your children emotionally. It's not about, I don't used to touch them, or me, I will use my mouth. No, your mouth is doing way more damage. Way more damage. There are lots of ways for you to correct your children. We are not saying don't be the typical African mother, but you can be an African mother with a change. Someone who understands that emotions also make up a child. And you have to protect their emotions so that they don't go and hear something else outside and believe this is what it is because your parents have already used it. But when you give birth to a child that you don't emotionally abuse, when they go outside and they see something that does not click with what they've been brought up to believe, they're going to clock in on it and say, this is not part of it. And they would, obviously, they will clock out of it. Thank you so much. Thank you so much, Dr. Mrs. Julia Ogunga. So I'm going to have you give us your final words in a minute. And what I just need you to do is, for persons who have had childhood traumas, what do you, and they're adults right now, people who have had to deal with childhood trauma, what advice would you give to them?
Yes, my advice actually is very simple. Once you're traumatized in childhood, first thing you will do is to get a clinical psychologist, get professional help. Because all these years you've been growing up, of course, you've been maybe interacting with other people and they're not really giving you that solution. Get a professional help. First thing you can do is to go to a clinical psychologist and tell the person, and they use, their psychotherapy and all that. But then if they believe that you need medications, they will now refer you to a psychiatrist who will now bring in medication. So two of them will work, it's reversible. The harms of,
traumas.
Yes, is reversible. So it's important.
Okay. It's amazing that you've heard that. And I hope that you get to share this video as soon as you can. Therapy is not a bad thing. And I think I need to resound it as much as I can, being a mental health advocate myself. Therapy or visiting a psychiatrist or a therapist does not mean that you're mad, like some people would like to say, or you're mentally unstable. No, you actually reaching out to professional help means that you're conscious about your complete health, physically, emotionally, and mentally. And it makes you a very conscious person and a well-learned person. So please, do not take all of these things in your arsenal and just dispose it just because you don't want the society to think that you're mentally unstable for visiting a psychiatrist. No, your mental health is important. It's important that you clock in on it and you fix it before it gets worse. Thank you so much for listening. This is where we draw the curtain. Make sure you like and subscribe. Follow us on all our social media handles at Serenity TV. Please go follow Dr. Ogunga on TikTok at Dr. Ogunga. All right? Dr. Julia, I beg your pardon. Dr. Julia on TikTok and of course on Facebook as well. You said it's
Brain Plus Specialist.
Exactly.
Brain Plus Hospital, yeah.
Please make sure you go follow us. Thank you so much and bye.